All right, up next is my pleasure to introduce Dr. Shane Terrell. Dr. Terrell did his DVM at Kansas State University, did his PhD in diagnostic medicine and pathobiology at Kansas State University. He resides in Gothenburg, Nebraska, and during his PhD, Shane's topic was lameness in feedlot cattle, foot rot, hairy heel wart, looking at infectious diseases, looking at mechanical injuries, and he has been in veterinary practice since 2011 with production animal consultation and consults feed yards, Colorado, Kansas, Nebraska areas, and he deals a lot with hairy heel wart in the field. And with that, take it away, Dr. Terrell.
Well, thank you, and thanks for the introduction. I appreciate the opportunity to speak with everybody today. I apologize for not having the ability to be there, but certainly enjoyed Dr. Ingleton's discussion there, and hope to have a productive talk. The first thing I guess I'll tell you is listen in on the end. Just make sure you don't follow Dr. Thompson's advice on personal protective equipment, and not only wear rubber boots when you go through the foot around the foot bath. Let's not do it barefoot. But yeah. Anyway, I'll kind of piggyback on what Dr. Ingleton said, but really my goal today is to talk a little bit about really the cost of lameness in general in the feed yard setting. Go through some of what we learned in the process of my PhD, but really how we effectively address it in our feed yards. You know, the feed yards that I get to go to range again from northeast Nebraska, which would be very similar, obviously, to your production systems in Iowa. We see significant hairy heel wart issues there. Confinement barns, and then as you move west, historically we had not seen much of it, but what's really telling was 2019 when we had pain conditions in Scott County, Kansas, or in Weld County, Colorado, that were very similar to those of northeast Nebraska or Iowa, and hairy heel wart incidents certainly popped up in a hurry. And now that we're back in a dry cycle and drought again, in those yards, I haven't seen it for 12 months. So, you know, some of the value of, you know, what's once it's in your pen, it's always there. Those type of things I certainly don't see at the end of the day. It's you know, it's keeping to the basics, and that's what we're going to try and go through today. So why lameness matters, you know, I really think this is one of the biggest opportunities we have, the lowest hanging fruit in the industry. You know, obviously significant factor in death loss and salvage slaughter for other causes, but really performance loss. And at the end of the day, when we talk to people outside our industry or show people outside the industry, our hospital pens or our big cattle pens with hairy heel wart concern, it becomes a welfare concern that I think is fairly substantial. So, you know, the cost effects, especially with feed costs where it is today, this is Dr. Gary Tibbetts' work that they accomplished at U.S. Mark and Clay Center, where we saw, especially at the end of the second half of the feeding period on calves within U.S. Mark's production system, we saw a tenth of a pound loss in average daily gain, and which corresponded to about 14 to 15 days of increased days on feed. You know, $4 feed costs. You know, that's a $50 or $60 hit for just having a instance that obviously doesn't account for mortalities or railers. So these pens that have 20, 30, or 40% prevalence of hairy heel wart, we can certainly estimate, that there's a likelihood of $40 to $60 lost performance on any one of those animals, and so it's absolutely significant for our industry. The cost of lameness, but the things that we do know, again, those additional 14 days, and then again the welfare test. What's if we're going to take somebody out into the field with, this is where a lot of our concern is. So the steps for improving all lameness causes, as we go through, obviously decrease incidence through prevention. That's facilities, flooring, pen maintenance, pen design, handling those cattle, nutrition, and then improve treatment success. And that's really what we'll talk about quite a bit today is, early intervention, the correct diagnosis so we can get to the correct therapy. So really, when we talk about early intervention and the value of early intervention in all my yards, across whatever disease it is, whether it's lameness, whether it's respiratory disease, really the things that we talk about is there's three drivers for treatment success. Once you get past prevention, when we start talking about treatment, our drivers for treatment success are timing of intervention, the correct diagnosis so that we implement the correct therapy, and commitment to hospital care. And so those are the three buckets that every one of my conversations in the feedlot, no matter the disease, that every conversation falls into. And so when we start talking about timing of intervention, how do we make those timing of intervention decisions, and how do we measure those things? In respiratory disease, we can use temperature, we can use lung scores, but in lameness, we really historically had made those intervention decisions really based on failure to keep up with a pen. And so for my grad school research, we took that and developed a locomotion scoring system through the support of Zimpro, and that's now a Zimpro Step Up system. But really what that was to track timing of pulls, and then we could associate case outcome differences across those. And so that locomotion scoring is really simple, intuitive. 0 is normal, 1 a mild lameness, 2 a moderate, and 3 severe lameness. And so we'll go through those quickly. Again, that's not the goal of today's talk, but just so we can make sense of some of the data that's coming to follow and why that's really important. So again, it's pretty intuitive. Locomotion score 0, animal walks normally. There's no apparent lameness or gait changes. So when we talk about a normal animal walk, and we're talking typically on a lighter animal, that animal's going to more or less replace that front foot track with its hind foot. But really, what we talk about more is symmetry of stride length, and so that the left side track is replacing approximately the same distance from the right foot track, and that's how we want to gauge that symmetry of stride length. And again, you guys all looking at enough cattle that this is pretty intuitive. But just for means of description here. So in our research, we did this at a walk. The other thing we'll be looking at is head movement. Is there a head bob, significant head bob? Is that head dropping 6 to 8 inches? Is it raising 6 to 8 inches? So a 1 is an animal that's got shortened stride length. The head may drop slightly, but there's not a significant head bob. So then mostly there's going to be side to side movement, and we can't identify specifically an affected limb. So on this, you can perceive a intuitive change in gait, but specifically that right side stride length is shortened compared to the left side stride length. And again, this is, we'll come back to the differences here on outcomes, but just quickly run through these. So again, there's some intuitive changes we can tell that there's a change in gait. But again, on this animal, left side stride length is shortened compared to the right side stride length. A locomotion score 2 animal then is an animal that's going to have an obvious limp, but the limb still bears weight and a head bob is present. And so this is it was an either or scenario. If they become a locomotion score 2 animal, as soon as they as soon as we can either identify an affected limb or a head bob. So these become pretty obvious, and again, this becomes important as far as making those pull decision thresholds. So that animal, again, we can identify the affected limb, that head's dropping out pretty significantly, 6 to 8 inches. You can see on that white fence backdrop really well. And so these are simple and straightforward concepts, and but again become very important when we look at making those intervention decisions. This animal has a left hind limb lameness. We can identify that. Again, you can see that head bob is significant. We can see that dropping out. And then a locomotion score 3 animal obviously is one that's going to be reluctant to move, applies little to no weight to the affected limb. And these are the ones that we're wanting to prevent. Some of these are catastrophic injuries, obviously, but other of these animals and some of these chronic Hairy Heel Wart lesions can definitely progress to this. And so intervening in the earlier stages, especially on a disease that is slower to progress, is pretty important to outcome and performance. This animal stops without pressure. As soon as he stops, he'll take weight off that limb. And, these are obviously the animals that we're avoiding creating and where it becomes a welfare concern when you don't address these animals in a timely manner. Again, hospital pen scenarios are the ones that we need to be committed to making the appropriate decisions for these animals. So I guess with that, we went ahead after the development of the locomotion scoring system, and we asked cowboys for a year's time across over 200,000 head of feedlot capacity. With that turning twice, there was over 500,000 head of cattle on the study. And what we asked the cowboys in those feed yards to do was to score those animals at time of first pull for locomotion score, and then we used a decision tree to diagnose those specific lesions and follow those outcomes by lesion and by locomotion score. So again, 45,000 head capacity over 12 months. So the causes and treatments that we utilized in our decision tree, we ended up, that animal either was diagnosed with foot rot, septic joint or deep digital sepsis, usually secondary to another cause, but at time of first pull, if that was in the joint, we considered it a septic joint. Hairy heel warts, laceration of the foot, upper limb lameness, laminitis, toe abscess or ulcer, a sole abscess or ulcer, or undefined lameness if they didn't meet any of the criteria for the above ones. So what we ended up finding, and why the locomotion score is important, and I think this correlates or would correlate highly for performance loss also, but we did not look at that on this study. But mortality rate for locomotion score, if it was pulled as a locomotion score 1 over that period, we had a 10% mortality on those cases, which was significantly less than a locomotion score 2, which was we had 20% mortality, and a locomotion score 3 was again statistically greater with losing about a third of those animals. There was a proportion that weren't given a lung score at the time of first pull, some of those catastrophic injuries, but those outcomes ended up similar to locomotion score 3. But so how I really like to look at these as odds ratios of death and railers. I think it makes most intuitive sense to me. So when we talk about an odds ratio, that's the odds or for risk of death or railed compared to the other locomotion scores. So when we look at locomotion score 2 cattle versus locomotion score 1, those animals were 2 times more likely to die than when compared to locomotion score 1. Locomotion score 3 was about 5 times more likely to die than the locomotion score 1. So you really noticed those significant jumps across locomotion scores. Locomotion score 3 versus locomotion score 2 was over 2 times greater, and for your risk of mortality. Interestingly, on railed cattle, locomotion scores 2s, we actually had a lower risk of railer. But if you look at those totals, our total railers and deads across 1s and 2s numerically were very similar. When you combine those, what we did is we ended up railing more 1s, and then more 2s subsequently died. So our total outs were similar. And so that's where we really look when we make a decision threshold for polls. That's with that differentiation, we really target polling those cattle as soon as they become a locomotion score 2 animal. When we're looking at railers, 3s versus 1s, we're about 1.5 times more likely to rail a 3 versus a 1. And then about 2.3 times more likely to rail a 3 versus a 2. So again, the purpose of that study and going over it is just to emphasize the importance of when we pull those animals. And again, no matter what the suspected lesion outside of laminitic cattle within our yards, practically we're using a 2 locomotion score 2 threshold to pull individual animals to treat, regardless of lesions. When we look at mortality rates, we had very low. This research was done in Northwest Kansas, Southwest Nebraska, and Eastern Colorado. We had very low hairy heel wart numbers in this. So this number is high, but not statistically different than most. It would be a high mortality rate for the cattle actually pulled for hairy heel wart in practice. Now you can see that confidence interval is huge, and so don't let that throw you off there. But our lesions that we had higher numbers of pulls, we had a 10% mortality rate in foot rot cattle. So when we pull those, this I think also tells the story of timing and intervention. When we pull those cattle early, our mortality rate again for foot rot is around 10%. Toe abscesses is about around 15%, but septic joint being a sequela to those other causes of lameness. Once it became a septic joint, once we had swelling in the joint, we lost a third of those cattle, and over twice as many as, or 2 times as much as toe abscesses and foot rots when they're at first pull. So again, that really is another indicator of the importance of that timing of intervention. So, again, getting it done early, finding the correct diagnosis. In our world in Western Kansas and Western Nebraska, it's been a paradigm shift to get people to look at the feet and not call everything a stifle that is showing signs of lameness, not call everything a foot. So making sure that we lift those feet, do a good job diagnosing those animals and coming up with the right diagnosis. So the decision tree that we use, diagnostic algorithm, this is what it looked like for the study. In practice, we don't necessarily use it in the same way, but this is really the decision-making process that we're asking our crews to do on a daily basis when they look at feet. And when they're looking at feet, we're using either ropes and pulleys or tilt tables in a lot of our larger facilities now, where we'll tip or cattle over unless there is an obvious foot rot, hairy heel wart, but we do ask them to differentiate the difference so we can treat appropriately. And once we get past that, then most of those are going to get tipped over to look for toe abscesses, sole abscesses, lacerations of the foot, etc. So part of my PhD work, we did do a study where we asked producers, nutritionists, and veterinarians in a survey what factors most contribute to the lameness. So when we talked about infectious causes obviously being foot rot and hairy heel wart primarily, the majority of respondents selected pin conditions in the top 4 pin surfaces, weather patterns, and fourth was cattle handling on arrival. For non-infectious causes, they targeted more of the handling on arrival, handling post-arrival or before arrival, and cattle temperament. But again, pin conditions were considered a important component to that. So when we talked about hairy heel wart, it's imperative that we talk about those pin conditions, understanding that we can only control what we can control, but continue to think about those areas that would harbor that slurry that allows for those bacteria to exist. So specifically, as we move on to hairy heel wart from the field perspective, we're going to talk about prevention, early intervention, and correct diagnosis. And these are really the 3 platforms that we're using in practice to manage these. And again, we'll try and give you some practical thresholds that we utilize here. So prevention, to prevent the disease, we have to do our best to understand the cause of the disease. And Dr. Anglican did a good job of discussing the multiple pathogens associated with hairy heel wart. Mostly that we find treponeme species, but it's very hard to replicate in an experimental pattern. But at the end of the day, no matter what the causes of these specific pathogens that cause this disease, the most effective killing of pathogens and I it's something that was really drilled into my head at vet school when we think about biosecurity, disease prevention. Sunlight and desiccation are nature's best killers. And so when we talk about managing pin conditions and managing outbreaks, and when we have specific pins that we have issues in, we just got to continually think about those things, manage them within the confines of the environment, and do the best we can. So hygiene is everything. So hygiene, any way we can get around it. So layover pins, if there's been significant issues, that's one thing that we've we have done is if we have a pen with a greater than 10 to 20% incidence, our expectation is that there is an increased pathogen load within those pens. It doesn't take a lot of moisture to house that bacteria and to let it continue to proliferate or at least exist. And so what we want to do is make sure that we get those water tanks cleaned and drained, but after we've drained those water tanks, we're going to let those pens sit for long enough that all those everything dries up and is dried up for at least 7 to 10 days, if at all possible. So if it provides a good opportunity if you're a all in, all out type of calf facility, is lay over those pens and allow those to get sunlight and let them dry out. If we get in a wet period, obviously that's going to be tough to do. And so the decision is, do you wait out till you get opportunity for drying, or do we suffer through? Again, water tanks, we in the West, again, we don't see a lot of hairy heel wart. As we get to eastern Nebraska, we obviously see more. Kind of in the area I live in, Gothenburg, we're kind of in the transition area there. We get significant moisture at times. We're in a dry period right now, but what we certainly notice is we kind of have a mix of water tank designs in this area. We have some water tanks with heaters that and floats and aren't continuous flow, and we have continuous flow water tanks that allow for continued drainage, and obviously cleaning those tanks for the continuous flow waters. We don't spill out any water around those tanks. It's certainly a consistent pattern that where we have heaters and floats and are cleaning those water tanks onto the ground, that we tend to have more hairy heel warts in those yards, at least anecdotally. And so I'm not telling, obviously we need to maintain sanitation and clean those water tanks, but definitely think about how those water tanks drain. Allow those areas around those water tanks to dry out in between groups, and do our best to, again, establish drainage the best we can to allow for that to dry out. I'm amazed in how many feed yards I've gone to historically where we don't see a lot of hairy heel wart, but we tend to see them in 1 or 2 pens. And when we dig down to it, there's an area of the pen that just, in those specific pens, it doesn't dry out. I'm not one that believes that it's necessarily, once it's in the dirt, it's always in the dirt. I think as long as we dry out those niduses of infection, I think that's extremely important. So we only have to carry a little bit of moisture in the pen to have those problems. And from a prevention standpoint, we, in yards that we have significant issues, we are using Footbath at every processing event. So most of those yards, that's going to be between 1 and 3 times during the feeding period. And we'll kind of continue that later. Intervention strategies. We're looking at pen level intervention for a Footbath if 30% of the pen show any sign of hairy heel wart. And again, a lot of these thresholds have been established with the consultation of Dr. Dorte Dopfer at University of Wisconsin. She's certainly, in my opinion, the world's expert in handling hairy heel wart. She's got, and some of you have certainly, I'm sure, spent some time with her or listening to her, but really those are the thresholds that she helped us establish for making those pen level decisions outside of Footbath a foot bath at a processing event. So what we do is we'll go in and look at those pens. If we count 20 head and we find 6 head that show any sign of a lesion, that doesn't have to be lame, are showing significant lameness if we don't see a lesion. And all we need is 6 out of 10 of those to meet those criteria. So the first pen level foot bath, we're utilizing either formaldehyde, primarily formaldehyde. We do use some copper sulfate and some of the Ultra 2-in-1 product, the formaldehyde copper sulfate product. But I'm certainly in belief that those are superior to a lot of the commercial products. And then kind of echoing what Dr. Engleton said, once they come into the pen level program, we don't see, or we don't look at foot baths as a curative path. It's a chemotherapy of that lesion, and so we're looking at repeating that every 3 to 4 weeks for maintenance until shipping. When we look at early intervention, again, we're looking for any signs of lesions. So pens like these, and again, this is something that was pointed out to us by Dr. Dorte. We've definitely noticed it in these pens, but pens that show changes, proliferative changes to that interdigital space. You can see on these, we have these clefts on the front end of the feet on these animals. That these aren't active hairy heel wart lesions, but when we see those proliferative or those changes, those structural changes, those pens tend to pop with hairy heel wart more often than pens that have that don't show these clefts. And so if we see a pen where we have, again, 10 to 15% of these cattle on arrival, we may target those for periodic monthly foot baths or as a prevention standpoint, even if they don't show us those signs of lameness. But we'll target those pens early in the feeding period for maintenance foot baths. So when we talk about foot baths designs, I think this is particularly important in the field, and that's if we're going to utilize it, or it needs to be easy to utilize if we're going to use it. So in our larger yards, some of our issues are it's got to be close to cattle, so we don't have to take them a long way. We've got to allow for good cattle flow. These baths need to be easy to fill, easy to drain, and easy to clean. And so with that, those are the things that we'll take into consideration when we're talking about a foot bath program. So, and I credit Dr. Kip Lukasiewicz, our partner in PAC, for designing most of these. And we really designed some really effective foot baths. This is one that we put in 2 years ago in south central to southwest Nebraska. This is about an 8-foot wide bath. It's about half as wide as a drover's alley, but in this system, these cattle can be taken down the alleyway. This front gate in the bottom right picture will be set at an angle, and you can't really see, but the back gate is also set at an angle where those things are taken down a 16-foot drover's alley, and then those gates are set where they will go at a 45-degree angle off that drover's alley into the foot bath, into an 8-foot foot bath, come through, and then they'll angle back into that drover's alley. So those cattle can either go right by normally in the drover's alley, so don't have to take everything through the bath, but this is kind of a half alley just off of it that's really easy to utilize if we're doing a pen intervention program. The other nice thing is the processing barn would be to the back side and to the right of this, and so we can set set the gates up. So those cattle exiting the chute in the processing barn can go through for a maintenance bath, and they'll just usually walk through slowly at their own pace, especially at a processing event, which I think increases the effectiveness if we can get some contact time in those foot baths where we aren't driving those cattle through. Again, some of our larger yards, distance is an issue. So this is a portable foot bath on a trailer that's utilized in one of our yards in central Nebraska. Cattle flow, this sits right inside of the 16-foot drover's alley. Cattle flow it's fair through it. They step up into it instead of go gradually down it. For a pen intervention bath, I like the step ups. Honestly, if we're going to drive cattle through a foot bath or a whole pen through a foot bath, these cattle will step in and jump into this foot bath, but because they're elevating to do so, they tend to take a few more steps in that bath, and I think it's more effective foot bath than a sloping foot bath. If we're coming out of a processing barn where those cattle are allowed time to kind of find their way through the bath, I like the sloping bath coming out of a processing facility where there's no rush on those cattle. This is a more recent one that we put in. It's kind of a combination of both. Again, this one's about a 12-foot wide foot bath. Again, offset from the normal drover's alley, kind of a alley offset that we don't have to normally take cattle through unless we're foot bathing. But this step up in this permanent bath is about there's about a 2-inch curb, and then down into the 12-inch bath that we're filling to about 5 to 6 inches. And so those cattle, again, they step down in there, or they jump into it typically more, but they end up taking more steps than on a slope bath. They kind of they'll step into it. They may not get all the way to the bottom of it, and can kind of clear the bottom of it at times where we're pressuring a whole pen through or driving a whole pen through the bath. When we look at corrective diagnosis or correct diagnosis and treatment, understanding the value of proper treatment and differentiating between, combination foot rot, hairy heel warts. On a true heel wart, we're going to use topical tetracycline, staying under 2 grams of tetracycline per animal. So that's if we have multiple lesions, we're going to split those 2 grams of tetracycline across the various feet. We'll wrap those animals in a loose wrap that we don't want to stay on for more than 3 to 4 days. I might imagine Dwight will go over Zimpro's new product, the biodegradable product. It's we've beta tested that in some of our yards. It's really been valuable. Hospital management, do they stay or do they go home? That really depends on your hospital system, but obviously, if you have challenges protecting the hygiene of your hospital pens, if you don't have a specific hospital pen for hairy heel wart, I would certainly advise, my advice would definitely to focus on going home on those animals so we don't potentially perpetuate the problem and spread it throughout the yard. If we do have a specific hairy heel wart pen, then those treated cattle can stay in those pens. Typically, if we have a hairy heel wart pen, we'll run that pen through a foot bath once a week to help with treatment. But again, if we don't have a specific dedicated hairy heel wart pen, we'll tend to go home with them. And again, a lot of our facilities, it seems like our drainage around the hospital is less than optimal. If our populations are higher, we just don't get dry out in those pens. So really focus on hygiene if we're managing those cattle through a hospital system. If there's any questions, or if we have time for them now, I can certainly entertain any questions now. But I do intend to be on, get back on the panel here in a little bit.
Thank you, Dr. Shane. One of the questions that came in on the chat room was, is there any correlation between manure pH and hairy heel wart prevalence?
It's a great question. Anytime we start talking about skin integrity, pH makes a difference. And I can't state that I know of any data or am aware of any data that shows any difference there. But skin integrity is vital. And as Dr. Ingleton said, when we start talking about moisture, obviously that affects the interdigital space. But we start having acidic, or acidic manure, that's definitely going to compromise the interdigital space and that integument, and so it would certainly have an effect there. We haven't done anything to try and control or manage manure pH in any of our yards, but I certainly would suspect that there's an impact there.
Have you noticed the individual treatments when you pull and use either tetracycline or formaldehyde be more effective when you get a better application?
Yeah, so definitely, if we had time to manage every animal with topical tetracycline with a wrap, I certainly feel like our outcomes on that is very positive. If we do a good job of cleaning that foot, or lift that foot, clean that foot, get a good application of tetracycline on and wrap it, those are really effective. Again, those changes to the skin are permanent on those lesions, and so will we have some relapse in those cattle if they're earlier in the feeding period? Yeah, definitely when available on those bigger cattle. If we treat those cattle and get them resolved, we obviously will manage the worst ones that are getting pulled for individual treatment. If we see some resolution in those cattle, we're usually shipping those cattle when we can, as soon as we see resolution within reason.
Any other questions? Yep, one more. Hold on. And there will be more. I'm going to reserve my questions for Dr. Terrell for the discussion.
Wondering if there are any common risk factors among the feed yards that you oversee for incidents of hairy heel wart.
I would, my bias 5 years ago would have been dairy influenced cattle and those, but there isn't hardly a feed yard I go to that doesn't see some dairy influenced cattle anymore, and I don't see any changes since we've seen that change in our industry. The biggest differentiators are obviously regionality. I don't think source of cattle is a big driver of it. Regionally, we see differences obviously based on moisture, but at the end of the day, the ability, even in these, like I said, in the specific region that I live in kind of in central Nebraska, central Kansas, where we variably see some yards where we see some high incidence and some that we don't see near as much. Water tank design, water or drainage around that water tank. It really matters, because we carry enough humidity that if we're spilling water over, if we don't have enough water tank space, and then we have cattle hogging water and really splashing water out, I really feel like those are opportunities to hold that bacteria even in drier time periods where we just don't get complete drying and desiccation of those areas, facilities where cattle aren't hanging around the tanks as much. Again, continuous flow waters and where we aren't spilling water around those tanks. That's probably the biggest yard difference that yard different that I don't see as geographical. But I don't perceive any difference by class of cattle. I mean, I've seen Sandhills and Nebraska cattle come in with Hairy Heel Wart. I've seen Montana cattle come into the yard with Hairy Heel Wart. I've seen Southern cattle come in with it. I can't say that I've seen Southwest cattle, but from pretty much on arrival, every other geographical region, I've seen Hairy Heel Wart.
All right. Thank you, Dr. Shane. We'll see you in the discussion round.
Sounds great. Thank you.
Thanks. Let's give him a round of applause.